welcome to Hellie's Clinical Trial Adventures. I'm actually on holiday at the moment. You might have noticed that I kind of sat doing these blogs in quite random settings. Mostly I've been filming them in our office, in wherever place I can sort of squeeze into. That's been a bit quiet. So there's been a bit of random backgrounds for where I'm at. But today I am at home in my kitchen with my coffee. Anyway, so last time I believe I told you that I got a telephone call from Professor Coles saying that I needed to stop taking the drugs. So I don't know, a short recap maybe. 2 weekends ago I ended up in A&E with really severe stomach pains, which proved to probably be caused by gallstones, and they found a rather large one. And then when I went up to Addenbrooke's, which will be exactly a week ago today, they did the blood tests, and then they called me up afterwards and said that my liver values were really high. And then I had an email later on from Dr. Nick saying something about the impressiveness of the liver values. I like to mark words, so I asked him, impressive? What do you mean by impressive? Is it like when I tell my 4-year-old, that's an impressive mess you've made there? It was along those lines. I looked up liver values and things on Dr. Google. Should never look up things on Dr. Google, kids. Don't do it. But yes, so I Googled things about the specific liver values, and apparently a normal one is, I can't remember exact values now, but I think it was between, say, 7 and 50, something, 54. My previous values had been between 15 and 20 up till last week, and then last week it was over 700. So I suppose that's quite impressive. So they asked me to go and have another blood test before I came up this day. So I had that done on Friday at my GP's, and they got those results on the weekend, and they emailed me on the weekend. I mean, they're amazing, the amount of, you really feel like you're in safe hands, because when would you ever be told about your results on the weekend? So it had gone down a bit. It was 270 something, so it's still high, clearly, as it's, if 50 something was the sort of upper end of normal. But it's going in the right direction. So I went up to Addenbrooke's today and had some more blood tests done. I don't know the results of them yet. I'm guessing that they'll probably find out maybe on tomorrow or Thursday. So they will probably email me then. So I spoke to Professor Coles about the whole situation, and he said to me that if the values go back as they should be, the normal values, then I can start taking the drug again if I want to, but it's up to me. I think it would be such a shame to give up on the trial, considering that I'm kind of feel like I'm part of the team and things now. So I said that I'd really like to be back on the trial if possible. But then I asked him, so if it is actually caused by the medication, because they can't tell that yet. They can't tell whether it's caused by medication or by the gallstones. So if it's caused by medication, is there any way that I could take any other medication to counteract it? Because that was what would be happening if you had thyroid problems, or if your blood fat's gone up, then there was other medications that you could take to counteract it. But with the liver, apparently there isn't. So you just have to stop taking it. So it's a bit of a bummer, I think. But I'm going to wait and see what the results will be, and hopefully they are okay now, and then I'll probably start taking the drug again next week, and then I'll have to start with the blood test again. And I guess that's the other sort of bad thing about it, is that I will almost restart the trial again. I don't think I will need to have all the tests and things done again. I hope not. Didn't ask about that. But I would have to go back to weekly monitoring, which, you know, makes sense because obviously this was quite a big abnormality. He did say that he hadn't had that happening before. I feel a bit annoyed, to be honest, if it is caused by the gallstones, because then that will kind of skew the numbers and mess it up a bit. Because you don't want it to be listed as a side effect if it has nothing to do with the drug at all. And again, I don't know if I'm actually on the drug or if it's the placebo. Apparently, your liver values can go funny when you have gallstones. I don't know exactly how that works, but I suppose it's all kind of connected down there. When one thing blocks up, well, it's kind of like a, I don't know, your human sewage system, and you know, if something gets dislodged or stuck, then you'll have all sorts of funny things happening with your taps and drainage and whatnot. So it sort of makes sense that the liver could go a bit funny from it. But what he said was that the specific value that had gone up so much is not normally the one that goes up when it's a gallstone. It's normally another value. But he didn't seem to think that this was specific to be expected for the drug either, if I'm actually on bexarotene. So who knows? Who knows? I'm going to have to wait and see. I guess I'm just going to have to enjoy my holiday without taking any more of these things. So these bad boys will have to stay and wait. And once I'm back from my holiday, because I'm going away for a few days, we'll have to see if we can attack those bad boys then. But I shall let you know. I sincerely hope that it's not the end of Hellie's clinical trial adventures, because it would have been a bit of a, I don't know, anticlimax, to say the least. But there you go. I suppose that's the way of clinical trials. They do go backwards and forwards and take unexpected turns. Right, I'm going to go and enjoy my holiday for a bit, and I shall probably see you next week. Bye.